join us later, just for, you know.
Okay, Monica, can you do that? Yeah. Okay, thank you.
Yes, we are now live.
Thank you, Monica. I'd like to begin by welcoming those members of the public and press who are watching the live stream of this meeting via the Council's website. Members of the subcommittee, you are by now aware of the need to keep your video camera switched on and for the duration of the meeting, and to keep your microphone muted except when I invite you to speak. Please click the raised hand function if you wish to ask a question or comment. There's always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjournment while the fault is addressed and the public broadcast will be paused. If it's not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I remind the subcommittee and officers that all virtual meetings will be recorded and that these recordings will be published on the Council's website. Thank you. Can I go to agenda item 1 before I take the roll call? Agenda item 1, apologies for absence. Monica?
Yes, Chair, we have received apologies from Charlotte Black, Gary Howsham, Bruce Camper and Louise Mitchell.
Okay, thank you very much. I'll do the roll call of those present. Members, I'll begin by calling the names of all members of the subcommittee. To establish your attendance, please confirm your presence. Councillor John Holditch.
Present, sir.
Thank you. Sandy Smith.
Good morning, I'm here.
Morning. Wendy Oger-Welborn.
Present.
Hi, Wendy. Liz Robin.
Present.
Great. And Jan Thomas, I know, might be she's in a meeting at the moment, I believe, and join us as soon as she can. And myself, Roger Hitford. Okay. Declarations of interest. Are there any declarations of interest, please? Please raise your hand if there are. I'm not seeing any hand raised. Agenda item 2, minutes of the 11th meeting of the 11th of September 2020 and the action log. First of all, the minutes, can I confirm the minutes are a correct record? Anyone with any amendments at all, please raise your hand. John, was that you raising your hand for something that's incorrect or to second the minutes or?
Seconded.
Okay. Sandy, you've got your hand raised. You're on mute, Sandy.
Thank you, yes. Yeah, just to say that it's Val is chair of Health Watch Cambridgeshire and Peterborough. For the minutes, it was just Cambridgeshire. Smashing.
Thank you for that, Sandy. We'll make that adjustment. So with that adjustment, is everyone okay that they're correct record? If not, please raise your hand. Thank you. That's affirmed. The action log. There are a number of outstanding actions. Wendy, could you provide me with an update on your 2 actions on page 3, please?
Yes, certainly, Councillor Hickford. So the care home support plan is a live document. We have had very good feedback from the region in terms of the quality of our plan, because there's a certain template that we have to complete. What I'd suggest is that we bring the care home support plan and the outcomes that we've achieved to the next meeting, if that's okay.
That's fine with me. Anyone object to that at all? No, that's fine, Wendy. Thank you for that. Okay, Liz and Wendy, can you provide an update on the 2 final actions on page 4, please?
Yes, Chair, the best start in life is... Oh, sorry, Liz.
No, it's you're fighting. I'll take Liz first. Liz, please.
Okay, I'd just say that those are covered in the agenda item, and I know that officers did go to quite a lot of trouble to prepare simple summaries of what best start in life is for the public, but Wendy has been more closely involved recently, so I think Wendy may want to expand on that.
Thank you, Wendy.
So best start in life is on the agenda today, Chair, so I'll cover it during that period if that's okay.
No, that's absolutely fine. Thank you. Okay. Caroline, can you provide an update on your action on page 3, please?
Oh, apologies. I haven't got access to the full documentation.
Okay,
Would someone be able to remind me what the action is?
I'm just trying to get the page up myself.
Okay, I can come
Please,
in if
please,
you'd like,
yeah.
Roger.
you,
To look
please.
into how PPE masks with visible mouth screen to support communication for those with hearing loss could be promoted. That was the action.
Oh, yeah, thank you very much, Liz. Yes, so I took that back, and I've had a conversation with our head of contracts and brokerage, who is leading on the communications with our providers, and she had been working closely with Emily in public health around promoting that. So there is some active promotion going on with providers around the use of those masks.
Great, thank you, Caroline. And thank you, Liz, for that help there.
Yeah, thanks.
I've also got one outstanding action, but I will come back to it as and when Jan joins us, if that's okay with everyone. And obviously, if she doesn't, it will be an outstanding action for the next meeting. Right, moving on. Better Care Fund update. So, Caroline.
Thank you.
Thank you.
Just at the time of writing of this report, I just wanted to note that we had very little national guidance in terms of the Better Care Fund for this financial year 2020-21. In rather good timing, actually, just yesterday, nationally, there has now been published a Better Care Fund policy statement, which does provide some clarity around that. So I'll update verbally on that as we go through the report, and I can clarify what the current position is. So just in terms of the Better Care Fund, just firstly wanted to touch on Better Care Fund reporting. As you'll be aware, at the last Health and Wellbeing Joint Core group, I did update around the Q4 reporting for last financial year, which was recently just resumed. Reporting had been put on hold due to the COVID pandemic. At the moment, we haven't been asked to do any reporting on progress for this financial year around the Better Care Fund. The policy statement did provide a little bit of clarity on that, and confirmed that we wouldn't be required to report on performance against the national metrics. It recognises that COVID has had an impact on those national metrics, and particularly the DTOC one, where reporting has been suspended since last March, so we're not collecting that data. However, we will be required at the end of the financial year to do a report around reconciliation of Better Care Fund finances. So we should have some information on that towards the end of the financial year around what's required, but that was likely to be a more streamlined report than we're usually used to. In terms of planning for 2021, the report outlines that last month there was a recommendation published by the National Better Care Fund team, which was advising that in the absence of planning guidance, health and wellbeing boards were being recommended to roll forward 1920 spending plans to ensure that there's continuity of service provision. As I previously mentioned, we have had a policy statement issued yesterday, which now confirms that there will not be a requirement to submit formal Better Care Fund plans for 2021. It builds on the recommendation of rolling forward plans for this financial year, and in line with the reporting that I've just outlined, there'll be a requirement at the end of the financial year to provide an end of year reconciliation statement. So very much the expectation is for local areas to obviously agree their local spending plans to ensure that we've got that continuity of provision and that we continue to comply with the national conditions which haven't changed. There at the moment not much indication around what next financial year is looking like in terms of 21-22. However, they're indicating that hopefully we should have some planning framework and guidance in early 2021. It has been confirmed though that the Improved Better Care Fund will continue into next financial year at the same level of investment, and we are expecting also the Disabled Facilities Grant to have a slight percentage increase next year, along with the CCG minimum contribution. But obviously those local allocations haven't been specifically provided yet. So what we're asking from the board today is obviously to note and comment the contents of those reports, but we're also asking for an approval to agree the recommendation, the report to continue to ensure that we have service continuity and the roll forward of 1920 expenditure plans into this financial year, so that we've got that formally approved, and the detail of that is outlined in the report and the appendix.
Thanks, Caroline. Thank you. Seems a sensible way forward. Any questions for Caroline at all? Seeing no questions, so the committee is asked to note and comment, which we've managed to note rather than comment so far, and B, approve the recommended approach for the Better Care Fund for 2021. Anyone disagree with any of that, please raise your hand. I'm not seeing, so they're carried. Thank you very much, Caroline. Jan, welcome. Jan, are you okay?
So apologies, there's quite a lot going on and somebody just did it, so I do apologise if I dipped out. It's quite the pickle.
It's not a problem. Are you prepared at all? We're just dotting the I's and crossing the T's, and there was an outstanding action from yourself. Oh, okay.
I may well be. Just give me 1 minute.
No problem. Shall I move on? Would that be best?
Move on and I'll come back to it.
No problem at all. Okay. So moving on to agenda item 4, optimising hospital discharges through the implementation of discharge for access. Who's taking that one? Liz, do we know? Liz, you're on mute.
Yeah, it came through from Carol Anderson. So it would be CCG, I think.
Is this one that we should maybe move? I know it's really, really busy with the CCG at the moment.
Should we move it to
the next meeting?
Yes.
Yeah. Okay, is that okay with you, Jan? Just nod. It's fine. Yeah. Okay,
yeah, sorry. I think there's quite a lot going on all at once.
No. And also that outstanding action, we'll take that to the next meeting as well. That would make sense at the moment. Okay.
Yeah.
Jan? Yeah. Okay.
I've actually got the question up now, so yeah, but we can do with it next meeting. That's fine.
Okay, smashing. Thank you. Okay, so we'll defer agenda item 4, moving on to agenda item 5, Best Start in Life programme update. Wendy.
Oh, I think Councillor Hickford, I think Sandy's got her hand up
Sandy.
for some reason.
Sorry, I'm just reading in front of me. Sandy.
Thank you. Yes, I just wanted to say quickly, if you're going to defer that item, we could add the Health Watch report to that, so you would actually get the patient perspective if you deferred it to your next meeting. And I just would bring the committee's attention to the Health Watch England report about discharge to assess during COVID, and it makes really interesting reading. And our local report will be very much in tune with that. So if you wanted me to get that circulated to you, I could do that.
Could you do that? That would be very helpful. Thank you. Thank you, Sandy. And thanks, Wendy, for pointing that out. I've missed that.
No problem.
So Wendy,
Yes,
over to you.
thank
Agenda
you.
item 5, Better Start in Life.
And I did just want to say, with the discharge to assess, I think it should be noted today that across the health and care system, people have worked incredibly well together in unprecedented circumstances. And I think Jan would concur with that, but it has been incredibly busy. But I did just want to note that I do think the system has worked incredibly well together, in circumstances we've never seen before. So thank you.
Yeah, so, thank you for that, Wendy.
Given that we've deferred that.
Sorry, Wendy, I was just saying it's good to note and comment and minute that. So thank you.
Yeah, thank you very much. And given that that's been deferred, that gives me more time to talk about Best Start in Life, which is incredibly positive. So thank you very much for asking me to update on progress. I will remind people about the strategy in a minute, but just to say that progress did slow down between March and the summer for very obvious reasons. But I'm very pleased to say that the feedback I've had from the incredible multi-agency team that are working on this is that we really have started to step up in terms of implementing the strategy from September. So just as a reminder, this is a 5-year strategy focused on pre-birth to 5. It brings together all the agencies and organisations that are delivering services to this age group. We've actually identified 3 high-level outcomes, which are children live healthy lives, children are safe from harm, children are confident and resilient with an aptitude and enthusiasm for learning. And we worked incredibly closely with children and families in our local communities to understand what support and interventions they would need to achieve the outcomes, but also how they would want that support and interventions delivered and where they would want it. So our approach has been very much a place and community-based approach. So bringing key professionals together from across the healthcare and education system to develop and deliver support and interventions relevant to each place and community. And we've actually got 3 pilot areas at the moment. One is in Cambridgeshire City, one in Wisbech and one in Peterborough. And each of those 3 areas, they are different priorities depending on what the local children and families feel are their areas of greatest need. And I'm really pleased to say that, like I say, there had been a slowdown in progress of developing those pilots, but they started in September, and we should at the end of February have the results from those pilots. In addition, I'm really pleased to be able to say, in terms of the communications, the communications group for Best Start in Life has been re-established, and they're working with a designer to create a logo and a brand for the Best Start in Life. And we're working to actually shortlist initial designs to get them out to families for user feedback before the Christmas period. And also we've got an initial specification for an integrated digital platform, and that's been completed by expert colleagues because we want one point of contact for children and families in terms of what services are available to them. So the focus of the pilots is very much on one team defined by place, making sure every contact counts and making the most of the data we have. So thank you very much. I'm very happy to take any questions.
Thanks for that, Wendy. And you said the results of the pilots will come back in February, which is really good news. Can I ask where they come back to here first, or where else they're going to go? They're coming back to here.
Yes, I'll bring them to here. I think it's really important that you see all the fantastic work that's been done, what actually the outcomes of that are. Okay.
And my other question is with data sharing. Obviously, this is fantastic that we are finding a way to do this. Have we found that seamless way yet, or is there still hiccups, or how's that particular aspects of the pilot going?
Well, I have to say, I do think the COVID pandemic has helped us not be as risk adverse in terms of sharing data. So I think there is people are working better together in understanding actually the value of being able to share data when it's in the best interest of the people we're trying to serve. So I think it has made it a bit easier. There will always be challenges, but absolutely we are finding ways around that in terms of having that one team around that child and family.
Great, thank you. Any other questions at all for Wendy on this, please? Sandy.
Thank you, Chair. Thank you, Wendy. So great programme. So we've got 2 comments and a question. So first of all, really good to hear about the integrated platform, because anything that makes things simpler for families has got to be great, with everything being rather piecemeal. Wendy knows well the dental problems, the oral health problems with we had your colleagues come and present to our board just before the pandemic in March and hear about the Better Start in Life, and we're really pleased to hear that around the work that's been done on oral health with children. So we're really pleased about that, and just to reassure the committee that Health Watch are continuing to raise questions with NHS England around access to dentistry, and naturally access for children to get dental treatment as well is very much top of that agenda. So that's my 2 comments. My question was going to be about the findings that we had in our 3rd COVID survey briefings around the lonely journeys of some mums giving birth, and just wondering whether the better start in life, and whether there's if that has been picked up or noted somewhere. Thank you.
I'll respond to that, Chair. To be honest with you, I don't know if it's been picked up in the 3 pilots. I will feed it back, but it has been picked up in my wider work in terms of the Children and Maternity Board, Sandy. That has been picked up in relation to that. But I'll certainly make sure that I let the pilot leads know as well.
Thank you for that. Thank you for the question, and Wendy, thank you for the response. Any other questions at all on this? Okay, so I'm not seeing anything. The Joint Subcommittee is asked to note and comment on the continued development of the Best Start in Life programme. I think we've done that. So thank you very much. A little bit ahead of schedule, you may notice. Agenda item 6 now, the forward agenda plan. Monica, is that yourself?
Yes, Chair, it is.
Is there anything we
There's
need to
no
note?
change. No, I can't see anything. I think everything has been published and no change.
Okay, thank you. Wendy, you've got your hand up.
I just suggest, Councillor Hickford, that we probably just need to review what's on the forward agenda plan. Given we've all been very busy, we probably want to think about what we might want to put forward to present to you over the next 6 months, year. Would you agree, Liz?
Yes, absolutely. I think we need to look at it again in context of COVID recovery and all of those pieces of work that have gone on across agencies, and get that fed really back into the board.
Yeah, that's good, and start our priorities. It's a moving landscape out there all the time, obviously. So that's a good suggestion. Thank you. Okay. So on that basis, I haven't got anyone else that wishes to speak. We have obviously deferred agenda item 4, hospital discharges, until the next meeting. But on that basis, I know we're all very busy people. It is a relatively short meeting, but thank you very much for your time. Thank you and goodbye.